Alright, let's be honest for a second. Who hasn't stared at a juicy pimple in the mirror and thought, I could just pop this real quick and be done with it? It's almost like a universal urge, right? That little bump just calls out to you, begging to be squeezed, especially when you've got somewhere to be or someone to impress. I know I have. It's tempting, and honestly, it feels like everyone's done it at least once, maybe even this week. But what if I told you that squeezing a zit in the wrong spot could actually be deadly? I know it sounds dramatic, but stick with me. Okay, let's talk about something called the triangle of death. It's not just a scary name, it's a real medical concern. No, I'm not making this up, it's a real thing, and doctors have been warning about it for years. The triangle of death is the area on your face that stretches from the corners of your mouth up to the bridge of your nose. If you draw lines between those points, you'll see a triangle right in the middle of your face. Dermatologists call this the danger triangle because there's a secret superhighway of nerves and blood vessels underneath your skin here. These blood vessels connect directly to the cavernous sinus, a major vein at the base of your brain. So if you pop a pimple in this area and bacteria get in, that infection can travel straight to your brain. Yeah, your actual brain. It's wild, but it's true. There are some wild stories out there, urban legends and real-life cases alike, like one woman who popped a pimple right under her nose. She thought it was no big deal, but within days, she was in the hospital with facial paralysis and a severe infection. Thankfully, she recovered after a long hospital stay, but it was a close call and a huge wake-up call for her and her doctors. Now don't freak out, serious complications are rare, but they're not impossible. Most of the time, popping a pimple just leads to redness or maybe a little scarring, but in this danger zone, the risks are much higher. If a staph infection gets in, you could be looking at heart inflammation, toxic shock syndrome, or even sepsis, a life-threatening reaction that can spread through your whole body. The point is, it's just not worth the risk. If you notice redness, swelling, or pain that gets worse instead of better, or worse, if you develop a fever and chills after popping a pimple, especially in the triangle of death, don't ignore it. Get to a doctor right away. It's always better to be safe than sorry when it comes to your health. And maybe, just maybe, next time you see a pimple in that danger zone, keep your hands off your face. Let it heal naturally, or see a dermatologist if it's really bothering you. Trust me, your skin and your brain will thank you for it. Take care of your face and it'll take care of you.